what are the demographics of the population that will be served with the expansion? Ethnic and gender.
I did not bring the UT survey, or I didn't bring it up to the table with me, the UT survey. What we can tell you generally are that this population is more likely, when you compare it to the Medicaid population, to be childless adults. It's going to be a bit more of a male population than what we traditionally serve in Medicaid, because many of our Medicaid categories are predisposed to covering females, like pregnant women. And this population is going to be more likely to be working, about 54% working. But I think we also have racial and maybe even age breakouts in the UT study that was done by the Center for Business and Economic Research that we can definitely get to you.
On the hospital assessment, would you give us just a brief description of why the hospitals want that, how that match works, and what type of guarantee you have that none of the costs are going to be passed on to consumers?
Well, I would say first it's a firm commitment from the Hospital Association to use the assessment from the information that we've shared here today, that they believe that it will be sustainable for the foreseeable future. As to why hospitals are interested in participating in this way, I think Mark mentioned it very, very well. There has been a reduction in uncompensated care payments that hospitals have received through the federal government, through a couple of federal government sources. They have been observing this issue for a while, and while those payments had for a time been able to help hospitals weather what are just those events of what the system at large is presenting right now, as they look forward, they see it's in their best interest to try to provide this coverage. As Dr. Taylor and others mentioned, it's something that we've known for some time that's been coming, and now it's here. So they're willing to partner with us for the foreseeable future.
All right, and when you say the uncompensated care is being reduced, it's essentially the ACA is designed to eliminate that uncompensated care money altogether, right?
That's right, and Medicare DSH was, I think, the first way that hospitals had experienced that, where they split what was the prior way of distributing those uncompensated care payments, those Medicare DSH payments, into two different pools with a very clear design to decrease 75% of what that original number was, and that's what hospitals are starting to see decline over time, and it's very clearly laid out, the pattern to reduce those payments.
And if you could quickly explain why the hospitals don't mind doing the assessment and what the federal match is that they pull down.
That's right, and I think Will may have mentioned it briefly, but the federal match on these expenditures under the Insure Tennessee plan, the 100% we've all heard, but the phase down 95, 94, 93, 90% in 2020 and ongoing is a great way to make those funds go further, and this is a way to do that, and so they see clearly the benefits of investing that way. That the 9-to-1 or 9-to-1 match.
All right. Thank you, Mr. Chairman.